Many pet parents believe that if their pet is limping or crying out, they're painful, but if those things are absent, they're inherently not painful. But that's just not true because your pets cannot talk to you, okay? Matter of fact, studies show that even patients that have a primary care veterinarian and are referred to a board certified veterinary behaviorist like me have a very high likelihood of having pain, discomfort, or systemic disease. In some veterinary behavior practices, it's up to 82%. In my experience over the past 17 years, about 50% of my patients come in sick in some sort of way. So you're looking for, first, asymmetry. That means different, not the same. So both sides of your dog or cat's bodies should look about the same unless there's some known trauma that you're aware of. The nail wear should be the same, not just on the same foot, but on the comparable feet. And if you see that one toenail is longer, we're starting to get worried. You should see that the weight is pretty much distributed squarely. Now, dogs do put more of their weight on the forelimbs, but you usually, as an observer, are not going to be able to see that. All right, so you should see a square stance. If you see weight shifting forward or backward, that animal is showing you that they're a little painful. Look for any changes in the way that your pet moves. If they used to jump up on the couch and they don't now, that's a problem. If they used to run to chase the ball and they trot now, that's a problem. Now, it's easy to blame this on fear, right? However, we're always going to blame it on pain until proven otherwise. This dog was refusing to go down the stairs without a lot of coaxing, and we'll watch that video first. The second video is after the dog had been given a non-steroidal anti-inflammatory pain reliever. Take a look.
Come on, Pop. Poppy, come on. You can come. Poppy, come on. I'll help you. Come on. Good job.
Another big misnomer about pain is that if pain is involved in the behavior problem, when you touch the part of the body that is painful, that is the only time that you're going to induce that behavior problem. Not so. And this is where behavior gets really complicated. In this study, looking at 12 dogs who were presented for the problem of aggression, 2/3 of those dogs had hip dysplasia and pain, but they were not aggressive primarily when they were touched over the hips. The dogs who showed their aggression first after the onset of pain, so no aggression before, those dogs were actually more likely to be impulsive, show defensive body postures, so they were trying to say, hey, stay away from me before they were actually touched, and they were more likely to be aggressive when manipulated. Several studies showed that dogs with atopic dermatitis are more likely to have many behavioral clinical signs and are more likely in general to have behavior problems. It makes sense to me. If you're itchy all the time, you're going to be a little irritable. It's also going to be distracting for you, so it's going to be hard to learn. Another thing that I hear all the time is my dog's licking, it must be anxiety. Maybe, but probably not. Probably it is dermatologic disease. So the likelihood of behavior problem is only going to be on the table as a differential once we have ruled out all dermatologic disease with a full workup. A full workup is not a consult with your vet. A full workup may actually entail going to a board certified dermatologist, but at least it entails having the proper testing done, skin testing, potentially blood testing, potentially a food trial or allergy testing. Once those things have been done, your dog's licking can be blamed on behavior, probably. But there's another big one that comes into play, and that's nausea. There was at least one study in dogs that showed that dogs who excessively lick actually have signs of inflammation in the gastrointestinal tract, and over half were cured by treating those particular problems with the GI, not with the anxiety. So if your animal is licking, go ahead and go to your vet, but ask for a GI workup and a derm workup. Pain and behavior are intimately intertwined. You cannot separate them. And if your pet has a behavior problem, do not stop turning over every rock until you and your veterinarian find that problem to make sure that your pet lives their very best life.